A lot of lessons, and we're prepared for this fight in the way we were in 93, 94.
And what are the major grassroots forces on the ground, and who do you see most receptive right now in Congress?
Well, let me start with the second question, then tell you what our forces are. I mean, the good news is that the congressional leadership is clearly receptive. So in the Senate, clearly Ted Kennedy is receptive and, really wants to make this his legacy. But we also saw Max Baucus from Montana, the chair of the Senate Finance Committee, put out a white paper in November that was in line with the principles that President Obama's put out, that our campaign has put out. And he again said this week he wants to, even he said yesterday after Senator Daschle's withdrawal that Baucus was totally committed to moving this. In the House, you got a new chair of Energy and Commerce, Henry Waxman, who's a strong commitment to this, reiterated that commitment, reiterated support for a public health insurance plan. Pete Stark has been the key person in Ways and Means, totally committed. So you've got leadership who's knowledgeable and really in place. Our campaign, Healthcare for America Now, so we've put together purposefully the biggest unions, so it's SEIU and AFSCME, the AFL-CIO, the National Education Association, the Communications Workers, United Food and Commercial Workers, the Move On and True Majority, the biggest online groups, huge community organizing networks, Center for Community Change and U.S. Action and ACORN, Children's Defense Fund, women's organizations, and a host of provider groups like the American Nurses Association and the American Academy of Pediatrics. And we've got 100 organizers around the country. We're organizing small businesses. The New York Times had an article 2 days ago about small businesses organized concerns, and a lot of those are members of a new group called Main Street Alliance we're organizing. So there's a progressive voice for small business to counter the NFIB. So this is a real movement we're building, and that's what it's going to take to stand up to the insurance industry.
Where does the U.S. Chamber of Commerce stand?
They stand no place. There's a Times article today that the one group that welcomed Daschle's withdrawal was the U.S. Chamber of Commerce because he was going to do too much. They continue to be opposed to any employer responsibility. I mean, one of the big decisions is going to be what President Obama said, that employers have to either provide health coverage for their employees or help pay for health coverage, with exclusion for very small businesses. But, the business community wants to talk about shared responsibility, but what they mean by that is their employers have to pay, their employees have to pay, the taxpayers have to pay, but they don't have to pay. And that the American public doesn't want that. And there are businesses who understand that if health care was more affordable, they can pay. But so the Chamber of Commerce will continue to be a huge obstacle.
When the New Deal was put in place, national health care, national health insurance was one of the goals of the inner circle of FDR, particularly Frances Perkins, the Secretary of Labor. She, in the end, was forced to let go of it if she wanted to save Social Security and other plans because of the AMA's opposition, the American Medical Association. Where is it now, Richard Kirsch?
The AMA is not the huge force of opposition that it was. As you said, in the New Deal, and also they were the key group that killed it when Harry Truman, really won in 48, a lot on his pledge to get national health care. The AMA wants to see something done. They're confused about what has to get done. They're mostly interested in protecting the incomes of specialist doctors, and so they're focusing on reimbursement issues. They've had a campaign saying it's really important to cover the uninsured, which is part of the issue. We need to have a system that gives good coverage for everybody. But we're not nearly as concerned about the AMA as we are about the insurance industry, about the drug companies who may be really opposed to anything that requires them to actually start charging reasonable prices and not continuing to make, outlandish profits at the expense of Americans. We're concerned about those elements like the Chamber of Commerce and in the business community and others who are saying we don't want any employer responsibility. There's a lot of doctor groups that the AMA doesn't represent, groups like the American Academy of Pediatricians and other primary provider groups, a new group called the National Physicians Alliance that will have doctors' voices as well as nurses' voices like the American Nurses Association, for the providers clearly want health care reform.
Finally, Richard Kirsch, do you have a recommendation for a new head of the Department of Health and Human Services, or also this new if they're going to divide it into two jobs, serving as director of a new White House Office of Health Reform?
No, we don't. We don't have a particular recommendation. We think the key thing will be first of all, that the person fully embraces and understands the approach that President Obama's taken, that the congressional leadership's taken, that our campaign's taken to this, and that they have the guts and stamina to stand up to the kind of interest in Washington. So we need people who have shown strength and guts and a commitment, and I think that's what we'll be looking for more than anything else.
Richard Kirsch, thanks for joining us, National Campaign Manager of Healthcare for America Now. This is Democracy Now! We'll link to that website at democracynow.org. When we come back, we're joined by the Nobel laureate Shireen Ebadi of Iran. Stay with us.